I heard it described earlier this week as in we're living in sort of a parallel universe at the moment. On one side, everybody is returning to normal and carrying on like COVID-19 isn't with us. On the other side, we've got rising infection rates yet again. I'm just looking at the figure for last week. It was around 4.26 million cases estimated just last week. And that's for those who are still testing.
No, absolutely. I mean, it's a staggering figure, nearly 4.3 million people with the virus. In the last week, we've had 16,000 admissions, nearly 1,070 deaths. So, when Matt Hancock comes on and says the pandemic is over, we have to take that with a pinch of salt. I mean, primary children and over 65 admissions are higher, actually, than the January 2022 peak. And there was a paper out actually yesterday that is interesting because it showed that 50% of ICU staff who've looked after patients in winter surges end up with some kind of functional impairment of, post-traumatic stress disorder. So this is not a trivial infection. And, we know about work and schools and education. And then you've got long COVID, 1.5 million people suffering from long COVID for many months, from the ONS figures. So, we're dealing with, as you say, a parallel universe because we're still in the epidemic phase. This is not endemic now. We're having, we had the BA1, the Omicron BA1 surge. As that came down, the BA2 kicked in, which is a sister variant, if you like, which is even more transmissible. We're actually now on our seventh wave. And as Professor Whitty has said, more variants will come. And at the moment, we're tracking about 50,000 deaths per year. So this is way beyond flu. This is not a cold. And the idea that it's relentlessly going to get milder is another myth because it was just by chance that Omicron seems to be a bit milder, although, in fact, if you're unvaccinated, it's about the same as Delta in terms of its impact. And yes, it's true that other coronaviruses are much milder, like colds, but they may have had many decades to kind of get to that point. And then the final thing is that our vaccination rates have stalled. 1/3 of our population are not boosted, and most children are not vaccinated. The other thing about it is that we know that the immunity from these vaccines are actually waning. So that after about 3 months, it drops from being, 90% plus effective against hospitalization and death down to about 70%. And that's a big drop. So, we must have a vaccination plus policy. We've obviously got to think about boosters, and I'm sure, all the scientific experts are doing that right now. But we need to think about ventilation, less crowding, increased air purification, or even sterilization. There are new techniques coming on board all the time, ultraviolet light, these HEPA filters and the like. So I think there's so many things that we can do, Sarah Jane.
Yeah. The phrase living with the virus is used a lot by the government, but do you think enough planning and thought and forward thinking has got into what that actually means? Because you mentioned some of those measures there. Be interested if you think we're equipped with the tools to go forward and live with this virus effectively, and also what you think about free testing coming to an end tomorrow, because without that, how will we know where we are in terms of we won't know levels of infection and therefore we won't have any data?
I couldn't agree with you more. I mean, you can't control a virus infection if you don't know where it is and how it's spreading. We know this is a very transmissible virus. It is difficult to control. It means we can't eliminate it right now. But we've got to get the levels down as much as possible. And as soon as you make it chargeable, okay, I've heard your list of exemptions, which are much better than they used to be, but it's not going to mean that poor people can get access. Your reports have repeatedly told us about the cost of living and energy crisis. I believe it's going to be something like £10 for a pack of 5 lateral flow tests for a family. That's a lot of money when you're either on benefits or low income and you're facing inflation and all the rest of it. I'm not sure that does it include bus drivers? It does seem to include clinically extremely vulnerable people. I'd like to see GPs having the power to prescribe LFTs for any groups that they consider warrant it, particularly if they're in a lower income group. But the other thing we need to do is, we should be wearing masks on public transport, and that should be enforced, I believe. And we should be doing it in public spaces still. I don't see that as a huge infringement of liberty, and it does make a measurable reduction in the prevalence. But my big worry is that we're going to get another variant, because there's so much of this virus around the world. We're in another thing that we could talk about if we had time. Only 11% of people in low-income countries have been fully vaccinated. There is a massive problem now. I was talking to the director of WHO for the whole of Africa last week, and she was pulling her hair out, basically saying this is completely outrageous. And of course, that's where the new variants are going to come from. So it's not true that the pandemic is over, and it's certainly not correct, I believe, for our Secretary of State for Health to say that if you have COVID, you should just socialise a bit less. I think you should be staying at home for 7 days. And I don't think he's right to say that this rise in cases has no particular cause for concern. I think it definitely does.
Professor Anthony Costello, really good to talk to you, Professor of Global Health at University College London and a member of the Independent Safety